Welcome back to the Medtech Business Academy. This is Scott Alexander. I'm here with Tom and Barbara, and we are welcoming back to the show a great friend of the podcast, Mr. Chait Razdan, who has been on before and for years was our number one downloaded episode. And so he was just recently knocked off his pedestal. We won't say by whom, and he wants to get it back. So we've been fortunate enough to have him come and join us. This has been a great conversation around things like Medicare, the changes that we're seeing there, how that's going to impact healthcare. We're going to probably talk about tariffs. We're certainly going to get into the topic of community and how important that is. And we'll see where else it goes. So, Chet, glad to have you here. I'll just jump in. You are famous for building community, being a great go-to for other folks in the industry. And I just have to ask, why do you do that?
I don't like myself. No, I'm kidding. First of all, Scott, thanks so much for having us on today. Excited to chat with you, Tom and Barbara. Always love being a part of this, of the MBA podcast. In terms of building community, I think part of it is just because I was spoiled growing up. Always had people around me that wanted to help people. I think from as a kid with seeing my parents always volunteering to my first few jobs in consulting and banking, having everyone around me, no matter the time of day or how much they had on their plate, willing to take out 10 to 15 minutes of their lives to chat with me was something that I've been ingrained in. And I think A, it makes you a better leader. B, it puts you into circumstances that you might not have gotten a chance to be a part of without doing that. And then C, it builds your own network and your own community as well. So I think when I set out to, I guess in my career and people idiotically started reaching out to me asking for help, I'm not sure that the help I ever provide for them is ever that good or helpful, but always willing to provide my own opinions and tell people what I think, whether they want to hear it or not. And I think that's been really important and been really valuable for me too, in terms of getting to know amazing people and have people like Barbara clicking like on LinkedIn all the times to try and she's helping me become an influencer, which one day I guess I might become.
You and Kendall Jenner, right?
Yeah, exactly.
That's fantastic. Well, so for those of our audience that haven't listened to the previous episode, you're the CEO of Care+Wear. Tell us a little bit about tell us about the company just briefly,
Yeah.
But what are you seeing in the marketplace that may be important for the listeners to know?
Yeah, absolutely. I think so. Brief background on Care+Wear. I started the company 11 years ago now. Had a lot more hair. It was more black, less gray. But had loved ones diagnosed with cancer, told to wear socks on their arms while they were getting treatment through their PICC lines. So saw people wearing socks on their arms and thought, wow, this stinks. There's got to be something better. And so started working with the teams at Johns Hopkins and my beloved UVA to try and create a better sock. And kind of while we were doing that, took a step back and realized whenever you go to the hospital, everything's always been focused on function and not on how it looks or how it makes you feel, and just wanted to build a brand in the healthcare space. And I think what is special about this in particular is Barbara is one of the first two hospitals that took a chance on us. We had no idea what we were doing. We just knew that we wanted to create a better sleeve. And she was the first supply chain person I spoke to that was smiled at you when you spoke to her and answered your call and returned your call. And more importantly, brought us into the hospital system. And UVA still 11 years later is one of our best customers and candidly one of our most important customers. But I think at the end of the day, what I've learned is just how many people want to make a difference in the world. And regardless of whether you're a nurse, you're a clinician, you're the janitor in the hospital, your supply chain, your administration, you're the PT, you're the receptionist when you walk in. I think what makes this really unique is everyone is there because they care about the world. And I think that's been something that we've been really focused on at Care+Wear is what can we do to make a difference? And so that's been really key. I think what I learned during the pandemic, for example, is everyone was like, oh my God, hospitals are so slow. Hospitals got so much PPE so quickly and did such a great job. People like Barbara were up at 5 a.m. They were still up at 2 a.m. Talking to you, trying to find the best solution. And at the end of the day, you learn just how much everyone cares. But I've completely not answered the second half of the question. Could you repeat that again? You'll learn this is a standard issue with me, is I just talk like the Energizer Bunny and I forget to answer the question.
That's all right. I don't remember what it was, so it'll come back.
Perfect.
Well, I'd like to maybe jump in because, I was really intrigued, chat with your background, first of all, and, with, being a leader and building that community and, listening to people that you really those skills that you put together earlier in your life, maybe even before your career started. So I'm just kind of curious, how did those things help you as a founder and scale a business, and maybe what could the takeaways be for those future entrepreneurs that are listening?
Yeah, absolutely. I think you hit the nail on the head on the first one. And I just talked to the founder of Pella earlier today, and he was like, you've done a great job of listening. And my comment was, well, I listened because I didn't know anything about this industry. I'm a former investment banker and strategy consultant. And so what I like to tell everyone is I'm really dangerous with Microsoft Excel. Not as much with Google Sheets, not going to lie, because you can't use the same shortcuts. But Microsoft Excel, I still take a lot of pride in my skills. But more importantly, is being able to listen to the customer and listen to the experts. And so what we did from day one is bring the experts and sit them around the table with us to design our products. So today we take a three-pronged approach to product development and design. We're first and foremost always working with clinicians. At the end of the day, someone like Barbara isn't going to want to work with you unless you're creating a medically superior product. And the way you do that is working with the people that know why something is medically superior. And so working with the nurses and clinicians to do that. Secondly, is working with the people that actually are going to wear the product. How do you get mass adoption? You get the people that are wearing the product want to wear it and bang down the doors of the supply chain team and the administration saying, hey, I really want this. And so I always go back to, as a kid, I had tubes in my ears 3 times. And I just remember being miserable going in to get surgery, being even more upset that I wasn't the cool kid getting his tonsils removed, because all of them were going on ice cream diets and I was being forced to eat Indian vegetables immediately after surgery. But most importantly, I was most upset about the fact that everyone was going to see my exposed backside. And my mom's an anesthesiologist. So as any good doctor, everyone operating on me were our family friends, because my mom had to insist on having the best doctor, the best nurse, the best technician, et cetera, around the table or around the patient, I guess, with me. And so I was most concerned that they were going to see my exposed backside. And they were like, look, we've seen plenty of butts in our day. And I was like, yeah, but I see you over Thanksgiving and Christmas. I don't want to be thinking about this ever again. So including that 7-year-old version in the design and development. And then lastly is bringing in a fashion and design approach to incorporate the latest trends, technologies, and designs. And whether that is working with brands like Oscar de la Renta, the Notori company, or we actually taught a class at Parsons School of Design, which if any of you have ever seen how I dress, you'll be shocked that the #1 fashion school in the world had me participate as a professor, I guess. But then just like incorporating the latest trends and technologies. And it all came back down to knowing what you know and knowing what you don't know and not being afraid of that. And I think so many founders are like, oh, I know this better than anyone else. And the truth of being a good leader is realizing your dream and my dream as the CEO is hire people that are smarter than you, so I can just kind of chill, sit at my table, drink water, and just have a good time. And I think that that's one of the most important things. And then the second thing I would say is you have to be willing to ask for help and not be afraid to kind of push someone to a decision. So, not to keep picking on Barbara, but UVA was taking a really long time to buy after they said, yes, we're going to. And so I emailed at the time the head of interventional radiology and CC'd Barbara and was like, hey guys, like, you're my alma mater. I love you more than anyone else. I want you to be one of our first customers, but we have the hated UNC Carolina Blue Tar Heels wanting to buy these covers, and they're going to be our first customer unless you're willing to move on it now. And so then they were like, no, of course we want to do this, and moved. And I think so many people are afraid of pushing to a decision, whether it's a sale or an investor or a partnership. And it's, why waste your time? Like, cut to the chase and get to an answer. And maybe it's not the answer you want to hear, but at the least you're hearing it now and not a year from now. And I will be the first to admit I'm not the best at that. I still take too long to get to an answer, but I think that's really integral. And then the last piece I think is finding people that believe in your mission and your vision. We're really blessed at Care+Wear, where every single member of our team has a personal story for why they're there. They will confirm to you that we do not pay the most, and I'm really annoying. So they're not there for me or for the pay, but they're there because they love what we're trying to do, and that is help everyone with what they're wearing in and out of the hospital.
So Barbara, go ahead, because
I was going to jump in here. Yeah, he's mentioned my name enough. I did not pay him to do this. Honestly,
I was wondering if it's a different Barbara, because that's different.
No, I'm not jealous that it's someone different or whatever. I've known him, as he said, for at least 10 years, and the relationship building is honest and true, and those sorts of things. Flipping the gears a little bit, because we're now in sort of a different state economically, what we're really looking at, and the sort of threats, if you will, or concerns about costs and things. So let's shift gears a little bit to tariffs.
Yep. And everyone's favorite word.
Yeah. And I wanted to know two things from your point of view as the business end of things. How concerned? What have you been thinking about? How are you thinking of if they're really affecting you or not? And then, because you are in so many different situations with providers, founders, other medtech companies and things, what's their feeling, and how do you have those conversations?
Yeah, no, it's a great question. I think tariffs is a perfect example where no one has the right answer. So what you can do is you can arm yourself with data, you can talk to people, you can understand as much as possible about what's going on. And so we've gone pretty deep. We've obviously spoken to our factories, we've spoken to all the embassies. Like the other day, our chief product officer was at the Pakistani embassy just trying to understand from their vantage point what's happening. We've obviously reached out to our representatives to understand, well, we live in New York, so I'm not sure they understand what's going on either. Not to make a bad political joke, but I think at the end of the day, what you can do is arm yourself and then have open and transparent conversations. So with our hospital partners, we've been really fortunate where they understand tariffs as well, because they're being impacted by it, by everyone, and they're willing to share in that burden, if not participate in that burden more than we are. And so it's something that you're openly transparent on. The second thing is continuing to look at, are there alternate options that make more sense? So we as a company manufacture mainly abroad. We continue to look and attempt to bring things in different countries, even stateside. I think someone asked me the other day, why don't you make your gowns in America? And I was like, look, the US, the maximum manufacturing capability is 10,000 units a month, whereas abroad you can make 35 million units a day. So when you think about the scale capacity and the ability to make product at a high quality that we are used to providing and with the best technology that we're used to providing, et cetera, we're just not there as a country yet. And I think that that's something where we can keep pushing people here, but regardless of the tariff, America is just not set for that right now. I think the third piece is continuing to work with the factories abroad too, because I think we've been really fortunate where we're working with them as partners, not as a customer vendor relationship. And so they feel a lot of it too. And so they want to help resolve the issue wherever they can and be smart about it, et cetera, and all doing it in a way that no one's going to get in trouble, et cetera. And then even continuing to refine the product. And Barbara might remember this from when we first pitched her, but one thing that I tell everyone is if you're buying the same product from us 5 or 10 years from now, then we failed you as a partner. Like we want to be constantly iterating, constantly improving. When you think about Google, for example, the Gmail logo for years had beta in the logo. If they can do that for hundreds of millions of people, then we sure as heck can do that for all of our customers as well. And that's been super important to us. So not only are you looking at innovating on the product side, but you're also looking at innovating on the cost side and what can you do to bring costs down? Because now more so than ever with tariffs or even without tariffs, every hospital has spent way too much money. They're losing money. Income is down. They're looking for ways to cut costs. And so candidly, from day one, we always had the mission of we need our costs to be the same, if not lower than what you're paying today. One of our partners, HCA, calls it the 3 Ps: better product, better price, better experience. I still haven't figured out how experience starts with a P, but your customer's always right. So we're going to call it the 3 Ps as well. And that's who we are as a brand and what we represent.
I would make a joke about Tennessee public education, but as a guy from South Carolina, I don't have a leg to stand on. So
yeah,
I guess talk to us a little bit too about sort of the relationships with accounts, and you mentioned sort of they're changing and that sort of thing. Like, how do you think about that? You've had a relationship with Barbara. Like, how does that factor into the products you make, the relationships you have? Just kind of what does that look like over time after the past dozen years, basically?
Yeah. I think now it's great because I'm definitely cold emailing less than when I started the company because we tend to know people a little more. I think a couple things. One, hospitals, and let me take a step back. If you're creating Microsoft Excel, if it crashes, the worst thing that happens is it crashes and you have to start your worksheet over. If you're creating a product that's touching someone in a hospital, if it has a problem, the way that a hospital thinks, and this makes sense, is, hey, this could cause someone to die. And so you have to be a lot more careful. You have to be a lot more thoughtful about bringing product. And so hospital sales cycle is never going to be, they meet you and 10 seconds later they say, let's buy this, here's the money, where's the product? And I think you have to understand that and you have to build that relationship with your hospital partners. We've been really fortunate in that I think we've seen hospitals willing and eager to build those long-term relationships with us and give us real-time feedback, whether it's positive or it's negative. When we started the company, we used to have a PICC line cover that was black that we would wash before manufacturing, and then we would ship to the hospital. We had tested it with actually UVA, Hopkins, and a few others, and there's no issues. We then sent it to a VA hospital where the black started pilling on the bandage that they were using. And it was baffling to us because we had no idea why. And transparently, we told them, we're like, look, we've never seen this happen. This is being used at the UVAs, the Hopkins, et cetera, of the world. And they haven't had this issue, but this is a concern to us. And I think by being open and transparent with them, we got a lot of trust where it wasn't, hey, we're going to blame someone else. We tested with them numerous times and we found out you had to wash it after production. So now all of our products are washed pre-production and post-production. And it's crazy that it was such a simple solution, but by working together, we were able to do that and come to something that everyone was really excited to be a part of that process. It also builds that trust. So now they don't view me as just a vendor trying to make money, but someone that cares about their patients, that wants to solve the issue with them. And I think that's where we actually have an advantage of being smaller and nimbler is if you have a problem, you're going to call me, and I'm the CEO. I'm also the mailroom attendant. I'm also the sales guy, et cetera. But at the end of the day, I have CEO next to my title. If you have a problem with a big company, you're calling someone who's super junior, who takes like a very long time to solve an issue. And I think that's where we can really differentiate ourselves. And so we use that to our advantage.
So, Chad, I'd like to kind of come back and then maybe put you on the spot here a little bit, but I enjoyed your discussion in around the tariffs and this discussion about the product iteration, because oftentimes people think about innovation as like this big, giant new product idea, but what you're talking about is also iteration and innovation in terms of manufacturing process. So with some of the challenges that you're seeing now with tariffs and supply chain, is that leading you to any other innovations, or is that changing your process on innovation at all?
Yeah, it's a good question. I'm trying to think. I think from interacting with factories and all that, I think we've innovated in terms of our relationships with the factories on both sides. So whether it's with the factory, with the hospital, with the consumer, we're incorporating tariffs into that discussion. So we just signed a new contract with a hospital system where we said, hey, no one knows what's going to happen with the tariffs. We're just going to not include that in the price. And whatever it is, you guys will be responsible for it when it comes. And this is realistically where we think it's going to vary between, but again, no one knows. And so having those open conversations, I think the second thing is because we're always looking at alternate locations, I think hospitals know we're going to be looking at what's going to get them the best price at all times. So a great example, pre-tariff, actually, we had started manufacturing in Africa. And what's kind of crazy about this is a lot of Chinese factories started building factories in various countries in Africa and actually moving over a lot of their staff over there, kind of thinking, hey, there might be some issues with China and the US. Let's get ahead of this. And so I think that's where we were able to be kind of nimble and quicker than most people. So when this happened, we were already set up. That being said, those factories are still early on, and so they're not manufacturing 35 million units a day like you can in China, Vietnam, India, Pakistan, et cetera. So you kind of use that with a grain of salt. I think the second thing I would say is continuing to look at time, to your point, on not just the supply, not just the factory, but how you're getting it to the US, how you're so whether it's, do you take a slower boat? Do you take a quicker boat sometimes? Do you air stuff in? And then I think the third thing, is, and someone alluded to this earlier and I ignored it at the time, but is in what industry, right? So, because we kind of straddle both consumer and healthcare, because at the end of the day, we're building a brand. So a lot of people will consider us a consumer company. And then we sell D2C as well, where if you're a patient or a clinician, you can actually come to our website and buy everything direct. You see on that side of the world, people, when we had the 90-day grace period, for example, tons of people were airing in millions of units to avoid a 30, 50, at one point 145% surcharge. And so kind of for us, we get to see both sides of it. And I think, again, at the end of the day, we see pros and cons of tariffs. And I think I don't think you'll ever meet anyone that doesn't want to be manufacturing closer to home. It's just, can you build the capabilities and that supply chain to be as high quality as possible? And then the last thing I'd say we're doing even more of is relying on our boots on the ground to keep us posted on what's happening, what they're seeing at other factories, et cetera. So we have people that we work with that go into every factory and are part of that. And I think that's been really great and really important for us.
So let me ask you just briefly, with all the cuts to Medicaid, everything that's really going on, and we know that it will affect a variety of different factions in healthcare and the industry or whatever. We've had a tough time over the last couple of years with rural health and those losing their either hospitals or clinics they had and things like that. You've mentioned very large medical centers and things, but do you do business either directly or indirectly through some of those IDNs and things? And what are your sort of thoughts about the rural healthcare?
I think it's a problem hitting everyone. I think it's rural and urban and the big and the small systems. Because think about it, right? If you're a big hospital system, you likely have some rural locations that are seeing the same things. To your point, maybe they're a little more shielded, but we have taken an approach that candidly GPOs hate, and that is, to us, every hospital is the same importance, whether you're one 20-bed hospital or you're 187 hospitals with over 40,000 beds. We provide the same pricing to all hospitals. We provide the same caliber of service. To me, when I started the company, I wanted to make sure that we were helping everyone, regardless of who you were. And we don't think it's fair to be distinguishing between our end user, whether that's a patient, clinician, or staff member. And I think when you think about, what's the impact of what's going on, it's scary. So many people will not be able to get the healthcare that they need or require. You see this in Virginia with UVA serving more people that are 3 or 4 or 5 hours away. And I grew up in a setting where whenever I broke my bones, it was a 15-minute drive to the hospital to get it fixed. And I, for better or worse, broke my bones 3 times. So spent a lot of time with the orthopedic surgeons. And I think, are there other areas that could help with that, like with the proliferation of ASCs and urgent care and stuff like that? Yes and no, but it's still scary. And those are also more towards people that can afford to pay, not people that need help and assistance for paying. And I think that's a broader scale issue that hopefully we can try and solve. But I think our part in that is how we view ourselves being able to help is continuing to try and get lower cost products for our partners and continuing to provide all partners with the same pricing, regardless of, again, whether you're a large behemoth or you're really small. Because at the end of the day, every clinician is trying to save a life, and we're there trying to support both that patient and that clinician.
Absolutely. I know we've been going for a little while and probably need to come to a close, but I guess we'll maybe do around the horn. Barbara, do you want to have some final thoughts for the audience?
Sure. I always am sad when Chait's time is coming to an end, because this was great as usual. The one thing that really resonated with me, because, we are the Medtech Business Academy. We want people to learn and stuff, but your voice a customer forward and always listening to all of those that are customers, whether it's the patient, the clinician, the physician, whatever it is. And I think that's the key thing. And I admire you for that. And the fact that you do mentor folks, I'm sure that comes through for them as well. So thank you for that.
Tom, anything you want to share?
Yeah, well, first of all, it's nice to meet you, Chait. This is the first time I've met Chait. And, for me, innovation is always starts with listening, right? And I was impressed by that. The listening, openness, and transparency, right? No matter what industry you're in, what end of the business you're in, those are always great starting points, right? Because that helps that communication. And for me, because I do a lot of work in innovation and with innovators, it's just always a great spot because you start down this journey, but by that listening and openness, oftentimes you find out you're having to, divert to another area. And I think you can learn a lot by that. And I think Chait and his team are probably a shining example of that we can all learn from. So I appreciated the conversation.
I'd say more of the team than me, but yeah.
Yeah. Just a couple of thoughts, and then Chait, I'll give you the last word. I think it takes a village, right? It takes a village to raise a child. It takes a village to make a company, particularly a successful company like you guys have been and continue to be. And I think just to reiterate what Barbara and Tom said, it's about understanding who's using it, how are they using it, how do you become a value creating member of the organization or the community, and that has a way of then allowing you to capture some value, not all the value you create, but a pretty darn good chunk of it by being a servant in that community. So I took that away and think that all our listeners hopefully can as well. But Chait, you've been fantastic. You've got the last word. What would you like to say to the audience?
I think that this is an incredible platform to learn from, and you've got 3 incredible experts that have a ton of experience that everyone can really it's a pretty incredible group to learn from. And I think that that's something that no one should take lightly. I think the second thing is the biggest thing I've learned is you can't be afraid to ask for help. And I think that at the end of the day, when you are a small founder, small company, we work with some amazing institutions now, but we're 10 employees, and for better or worse, we can't do everything on our own. And not being afraid to tell your customer that and ask them for help, I think has been incredibly important and incredibly powerful for us. And then I think the third thing is it's people like the 3 of you that cause us to want to do more and innovate more and help more people. God, I'm like tearing up now. No, I'm kidding. But all bad jokes aside, I think there's so much more that we can do together. And I think it's, when you think about, you can never be happy just resting on your laurels, is how I think of it, is there's always more to do, and there's going to be more problems that come up, and all you can do is work together to try and find solutions and make the world a better place.
Well, that's fantastic. Well said, Chad. Thank you for that and for the time here. And I want to thank the listeners as well for joining us and listening through. Just as a reminder, please subscribe and share this and other podcasts with your friends so that we can help to make the world a better place. So thank you so much, and look forward to talking to you in our next episode as well.